Hello, I'm Dr. Castanet again. I'm going to discuss briefly the topic of injections. When are injections appropriate? You know, there are a variety of injections that are used for pain management for patients with neck and back pain, and I'm just going to discuss neck and back pain because injections and pain management exist for extremity problems too, but I'm just going to limit this to the spine. I'm certainly no expert in pain management and injections, but over the years I've referred people for a host of injections, epidural steroid injections, selective nerve root blocks, facet injections, that sort of thing. And you know, these are typically corticosteroid preparations that are injected in areas that are inflamed and a source of pain. They can be a godsend when somebody has severe nerve compression and inflammation of the nerve root, what we call radiculopathy and radiculitis, that causes pain down the legs or the arms. So I'm not reluctant to send people for that. There is a little risk associated with them, more so than non-invasive procedures, but certainly well worth the risk most of the time. It's never a first course of treatment. I do not send people for that until I've demonstrated to them that, and you know, to their satisfaction, that they're not going to improve sufficiently without them. And I don't know that on the front end. Most of the time I can improve them sufficiently with physical therapy and usually specifically spinal decompression if it's a pinched nerve or a herniated disc. Usually I can improve them sufficiently with these means of treatment, and I don't have to send them for injections. But I would estimate that I probably send about 8% of patients for epidural steroid injections. It's a much smaller percentage than most because I do have this very effective alternative tool, the spinal decompression, to pain management injections. And most physicians don't have access to that, and they're not aware of it. As a result, they send many more people for pain management and epidural steroid injections. Even those that are aware of it, sort of casually and at arm's length, but don't have direct clinical experience using it themselves, even those doctors give short shrift to spinal decompression and cannot really appreciate the clinical significance it has for patients and clinicians. So I'm very thankful that I have that as an alternative to injections. Nonetheless, about 8% of people I do end up sending for injections. Now, I probably would send a few more out, except that about 30% of the people that come to me have already had the injections. The reason I seldom send people out right away for them is most people will start to get improvement right away from spinal decompression treatment. That means that, and since most generally would like to avoid injections if possible, most of them can do that because they're starting to trend better from the initial treatment or few treatments with spinal decompression. There are occasions when progress is slow or the person's in very acute pain, and I always discuss that with them as an option. I am here to inform patients about what their alternatives are. If they need my guidance about what the choice I would make, I will tell them that, but I'm always reminding them what their options are, what is the lay of the land, when it's appropriate to do diagnostic testing, whether it's imaging like MRI imaging, whether it's appropriate to do injections. Sometimes I'll suggest a dose pack. That's a 6-day to sometimes 10-day dose of corticosteroid orally. It's less risky that way, it's less invasive, it's less costly. If patients are phobic about needles, it's less frightening or anxiety producing, and it's more accessible more quickly than steroid injections, and it very often suffices to get them bide a little bit of time or help them out with acute pain before they can get better enough through the physical therapy and spinal decompression treatments. So that's how we handle injections. We discuss it all the time when it's appropriate. Patients always know they can pull the trigger when they're ready to consider that as an option. I can set that up. And I guess that's about it. I'm not going to get into a lot of details about the nature of injections. You can go to a variety of websites for that. I happen to send people to a great pain management group locally here where I am. They're a group of anesthesiologists that specialize in pain management, and they're excellent, and patients are well served by them, very competent. They refer patients to us as well because they are committed to helping patients through whatever means they can, and thankfully they're now aware that spinal decompression is surprisingly effective for many patients that didn't improve enough or that failed to improve from pain management. I might add one other thing, and that is that there are occasions when even post-operative patients do well with spinal decompression. But I'm going to discuss that in the spinal surgery topic because there's a time for spinal decompression throughout our lifetimes, often even after we've had back surgery. So I'll discuss that in a later episode. Thank you.